I just want to give you a quick overview of some vaccine facts. I'm going to start with the ingredients, some things we should know about them, right? Poisonous, known to cause cancer, can be incorporated into your DNA, neurotoxin, probable carcinogen, known to cause cancer in animals, poisonous if ingested, probable carcinogen, brain tumors, brain damage, Alzheimer's, poisonous if ingested, second most toxic element on Earth. Mercury toxicity symptoms are similar to those of autism, nerve poison, mental retardation, toxic to all cells. Now, if somebody who's in favor of vaccines were seeing this, they'd say yes, but the amounts in vaccines are so minuscule that they do not have an impact on people. Well, dosage is absolutely critical to toxicity, but it's really the dose-time relationship that's critical. So in order for us to know the dosing and the timing of the vaccines that we're giving to children, if it's a problem, what we need to do is study those who've had all their vaccines on schedule versus those who have had none. Has the government done that? No, they have not. Right? This is a FOIA request as of July 29th, 2020. The CDC has not conducted a study of the health outcomes in vaccinated versus unvaccinated populations. They admit it, even though people have been asking for this for decades. Now ask yourself why the government refuses to do that comparison. Safety studies used to license our vaccines are vaccinated versus vaccinated comparisons, or vaccinated groups versus no control group at all, right? That's what this tells us when they won't do the vax versus unvax comparison. If cigarette companies only compared smokers to other smokers, would that be acceptable? Because that's where we're at. How are vaccines licensed? Right here, just a couple examples. These two hepatitis B vaccines. This one was studied for 4 days prior to licensure. This one for 5 days. And listen, don't take my word for it. Go to reference 157, which is the vaccine insert, and you'll see right on the vaccine insert, all subjects were monitored for 4 days post-administration. These studies had no placebo group, like I was telling you. Here's another one, polio. This one was monitored for 48 hours. The subject group got polio and DTP vaccine, and the placebo group got a DTP vaccine. Yeah, Webster's Dictionary definition of placebo, DTP does not fit that definition. Now you might say to yourself, wait a minute, Antonio, that's criminal. How can they license these vaccines with that level of study? You'd be right. And I Can Decide also agrees with you. This is a great organization to donate to. I've stolen some of my material from them. Anyway, they've petitioned the government to say, hey, you should remove the licenses for those vaccines because they should not have licenses with that level of study. Now, let's look at 1985. Right, in 1985, we had 3 vaccines, DTP, polio, MMR. Look at the vaccination rates, 63%, 53%, 61%, right? And we didn't have any of these, right? Kids back then were healthier. The generations born prior to the 1980s had a 12% chance of chronic disease. This generation has a 54% chance, right? Back then, they used to serve peanut butter and jelly sandwiches in school. Now you can't come within 100 yards of a school with a peanut, right? Kids were healthier in 1985. Today's vaccination schedule is out of control. It's definitely part of the problem. Here's vaccines requirements by year, right? In the 1950s, it was 7 shots. In the 80s, it was 10 shots. At 10 shots, the vaccine manufacturers were getting sued so often, they told the government that they were going to stop making vaccines unless they were given freedom from liability. And that's exactly what happened. They were given freedom from liability. That tells you, by the way, how much the government is in bed with the pharmaceutical companies. They are the number one lobbying firm, bigger than big oil. Children now get 10 shots by the time they're 4 months old. All right, so it's just out of hand. They get about 50 shots by the time they're 18. They get their first shot at birth, and it's for an STD. Why does a child need an STD vaccine at birth? A 5-pound premature baby and a 300-pound man get the same shot. They're not body weight adjusted. Then then the shots went up to 36 and then over 50. Now look at the explosion that happened after the 1980s, after they were given freedom from liability. Now, here's the explosion of autism. Look, 85, right? Once the vaccines exploded, autism exploded as well. Now, correlation does not mean causation, but what the correlation does mean is you should study the things properly. Thousands of parents have made the claim that vaccines cause their children to regress into autism. I can prove thousands. It's probably millions. Tripedia, which was discontinued in 2011, literally listed autism as a side effect. There are over 100 studies showing a vaccine autism link. Go to reference number 41 if you'd like to see that. And here are some sample court awards, right? These are people who went to court, said, my child was brain damaged after vaccination and regressed into autism. The court does not award people victories without evidence. And they know it. Here's the Merck manual. Encephalitis. Encephalitis is inflammation of the brain that occurs when a virus directly infects the brain, or when a virus, vaccine, or something else triggers inflammation, right? Brain inflammation is a hallmark of autism. Johns Hopkins, they know that there is a link between vaccines and brain damage and autism. Now, we shut the world down because we thought coronavirus would kill 1% of our eldest, sickest members. Autism is creeping up to 3% of our children and about 4% of our boys. And the U.S. government won't even tell us the autism rate of the unvaccinated population. You could be the most pro-vaccine person in the world and say to yourself, hey, listen, I need to walk into my political representative's office and tell them that they need to tell us the autism rate of the unvaccinated. All right. There's a lot more information, like I was saying. If you want more, reach out. Thanks. Bye.